What are surgical margins in radical prostatectomy? Imagine removing a troublesome part of the prostate to fight cancer. After the surgery, doctors examine the tissue under a microscope to see if any cancer cells are left behind. These edges of the removed tissue are called surgical margins. If no cancer cells are found at the edge, it is called a negative margin, meaning the cancer was likely completely removed. But if cancer cells are present at the edge, it is called a positive margin, which suggests some cancer may still be in the body. Having positive surgical margins is an important factor because it can influence future treatment decisions. Studies show that about 11 to 37% of prostate surgeries result in positive margins. When margins are positive, there is a higher chance that the cancer might come back, especially indicated by rising prostate-specific antigen levels. This is called biochemical recurrence. It does not mean cancer definitely returned, but it signals a higher risk. The length of the positive margin also matters. Longer margins with cancer cells at the edge tend to be linked with a greater chance of recurrence. The most common places for positive margins are the tip of the prostate, called the apex, and the sides near the nerves that control erectile function. These areas are tricky because surgeons try to preserve nerves for better function, which can sometimes make it harder to remove all cancerous tissue. Before surgery, doctors use imaging tests and biopsy results to plan the operation carefully. They aim to remove enough tissue to get rid of all the cancer while trying to preserve nerves and other structures for better quality of life. During the operation, surgeons decide how much tissue to cut based on tumor size, location, and other factors. Sometimes they cut closer to the tumor to avoid leaving cancer behind, but this can increase the chance of positive margins. If a positive margin is found, it does not mean the cancer is definitely still in the body. It does mean that the patient needs close follow-up. Additional treatments like radiation therapy or hormone therapy may be recommended to lower the risk of the cancer coming back. It is also important to remember that each person's situation is unique, and treatment plans are tailored to individual needs. In summary, surgical margins tell us whether all the cancer was likely removed during prostate surgery. Negative margins are the goal because they suggest a complete removal. Positive margins indicate a higher risk of recurrence and may lead to further treatment. Always consult with a healthcare professional to understand what these findings mean for your specific case and to plan the best course of action.